Physician documentation is incredibly important, and sometimes I wonder if physicians really understand why it is important. We've had challenges recently, especially with electronic medical records that are sometimes hard to use, sometimes aren't efficient to use, and physician documentation has suffered because of that. In our new healthcare system, and even in the old healthcare system, it's incredibly important to document well, because that documentation is the foundation of communication that occurs between the healthcare team. And as you know, with our patients getting older and sicker, it's a team approach to managing patient care. The doctor, of course, is the leader of the team, the captain of the ship, but there's nurses, there's dietitians, there's physical therapists, there's specialists. There has to be robust communication between all these providers in order that the care is fully informed by everybody, is coordinated, and again, if everybody's communicating, we can work better as a team to get better outcomes. It's sort of similar to a football team. When you call the play, everybody knows what they're supposed to do, everybody works as a team, and then hopefully you can advance the ball down the field. If people are doing different stuff and they're not coordinated, you don't get a good outcome. You don't get a touchdown, you don't get a field goal, you don't get a first down. And there's a similar analogy with the race car pit crew. Everybody knows what they have to do. They go out, they do it. It takes them 3 seconds or less to do it. The car's back out on the road. So any kind of teamwork involves a lot of communication, a lot of coordination, and physician documentation is really what enables that to happen. Without that kind of coordination and communication, outcomes aren't as good, patients aren't as satisfied. They see doctors coming in telling them different things than the nurse told them or than the specialist told them. The perception of the care isn't as good. Without the physician setting up the play for the day or the plan for the day, everybody doesn't know what's going on or why. If they do know what the doctor wants to do and why he or she wants to do it, they can execute that plan. They can feel more comfortable and confident in their job. Patients can detect that, and again, outcomes are better, and it's just good for the whole system. It's a win-win-win. The doctors feel better about being doctors. The specialists are communicating with the primary care doctors, and so they feel more confident and comfortable in their care plan. We have people looking out for each other. If somebody makes a mistake, somebody else can catch it. So physician documentation is incredibly important. And of course, it's not the only way we communicate, but it's that foundational way. And then once you read the doctor's note, you can call the doctor, you can text the doctor, you can email the doctor, you can communicate face-to-face. Other communication has to happen, but it's that foundational communication that happens through the physician note. And when doctors don't document well, you lose that really important tool, that really important aspect of care that can really enable better outcomes, better care, more efficient care, better utilization of resources, and just everything that we're trying to achieve in our new healthcare system, as we need to improve the quality, have affordable costs, and have truly high value care. Another reason to document well, and this is what I used to do, is if you write a good note today, when you come back tomorrow to take care of that patient, you read your last note and you can just take off from there. It makes it much more efficient and much easier. If you take care of patients in the hospital and then in your office, if you do a good discharge summary, the patient comes into your office, you read your discharge summary, you remember exactly what you did and why you did it, you know all the information about that episode of care, and then you can just take that right from there, take that care forward. It makes it a lot more efficient. The quality is much better, and you'll enjoy being a physician much more if you document well.